first, live, local. This is Fox 12 Now.
And hello, everyone. This is Fox 12 Now. I'm Greg Nibbler. As always, appreciate you joining us on whatever platform you are watching on. We cover a lot of segments on the show, but something I think that we've all been affected by, whether that's personally or just knowing someone, are some of the illnesses that have been around here. And that's not just here in the Portland area, but all over the place. I'm talking about respiratory illnesses that have been happening. Of course, there is COVID, but also more than that. And to talk about this, well, I was very grateful to have an expert join us from the Oregon Health Authority. We have Dr. Paul Cieslak. And Doctor, thank you very much. I'm sure you're very busy right now, but having some time to come talk to us, I think, is really important. And I guess first off, thanks for being here.
My pleasure. Thanks for having me.
And I think, to kind of give an update of where we're at, what would typically be things that we would see around this time of year?
Well, it's viral respiratory season. So not only would we typically be seeing COVID-19 as we have for the last few years, but influenza, respiratory syncytial virus infection, and other respiratory viruses are circulating pretty widely about now.
And is there anything different this year compared to other years? I mean, obviously with COVID-19, but we've been experiencing that for the last few years. But outside of that, are there other viruses and illnesses that are going around that are atypical for this time of year?
No, I wouldn't say so. I mean, we're seeing influenza on the rise. It looks like RSV, respiratory syncytial virus, has peaked and is probably on its way down now. But this is sort of typical. We usually peak in January or February, sometimes as early as December, and that seems to be the pattern that we're seeing this year.
So that's, I guess, overall then a good thing.
Yes, I would say so, although one of the things I tell people or I remind people is that every viral respiratory season is a bad viral respiratory season. Lots of people end up in the hospital, even in the best of years.
And I've certainly noticed it, with a number of people getting ill just around me, just in general in life. And some of the symptoms that a lot of people seem to be having is a recurring cough. Granted that could vary from person to person, but is that a symptom of any of these specific viruses that are going around this time of year?
Sure. All of them will cause a spectrum of illness ranging from, almost nothing to the common cold to pneumonia and needing to be in the hospital. It's impossible to distinguish which of those infections you have without getting a test. Some of them are a little more likely to be severe. I would say COVID-19 may be the most likely to be severe and to put you in the hospital, but any of them can do it, and any of them can also be mild.
And anything specific, I guess, when it comes to obviously general population of people that could be more susceptible? I would assume older populations; those are immunocompromised. But are there any other things that people should watch out for just for being in a specific demographic category?
Well, the people who are most likely to end up in the hospital, as you pointed out, are the older folks. With all of these diseases, they tend to be they're a little more fragile if you're my age, and you get one of these, you're more likely to end up in the hospital. Infants are also more likely to end up in the hospital because they have very tiny airways. And if you plug anything up with mucus, they can end up in the hospital. And people with underlying medical conditions, especially heart and lung disease. And with COVID-19, I would say in particular, we see high rates of hospitalization among obese patients. And so being overweight is also a risk factor.
So taking those factors into consideration and then also just for the general population, there tends to be a point where you're like, okay, this is just a bad cold. This is the common flu. I can fight my way through this. Is there a specific point or certain things to look out for where it's time to, go seek an actual doctor or even the ER in a specific situation?
Sure. Well, in many cases, it requires some judgment. Am I feeling much sicker than I usually do when I get a cold? In particular, if you're having any trouble breathing, that should get you to medical care like right away. You don't want to be, going too far down the path of being unable to breathe because if you get caught early, sometimes, with medications, they can stop you from having to be put on a ventilator, or in the intensive care unit. So any difficulty with breathing, and other than that, I would just say whether you feel sicker than normal, whether you can't keep any food down, things like that.
And what are some general safety tips and guidelines that people can go by just to try to mitigate some of these illnesses, or at least the the inevitability of maybe contracting some of these?
Get vaccinated, get vaccinated, get vaccinated. That's really the top line control measure for all of these viral infections. After that, it's common sense things like stay home when you're sick. We don't want people to be out there spreading viruses if they're, coughing a lot, for example. Wash your hands frequently. And, if you're a high risk person, you should be wearing a mask this time of year if you venture into areas where there's lots of other people any one of whom might be shedding a virus that you don't even know about.
As we're heading into, we're close to February, March, just a little bit before spring, but at least later here in the winter. Is there any kind of forecasting going on as far as some potential things that could be on the horizon that we should need to be watching out for?
Well, influenza is still on its way up. So, that's something against which you should be vaccinated if you haven't been already. It's not too late. The virus is still circulating and it's on the rise. COVID-19 appears to be fairly flat. We would still advise getting vaccinated. I certainly did. And RSV appears to be going down. After that, I can't predict whether any other new respiratory virus is going to rear its ugly head and teach us a lesson somewhere. But those are the big three.
So it's really follow those safety advices that you just gave, and then try to do your best to keep from spreading something if you do think that you've contracted something.
Exactly.
All right. Anything else that you think people should know about?
No, that's all I've got. Talk to your doctor if you have any questions about vaccination, but in general, the vast majority of people should get vaccinated.
All right, Doctor, thank you very much for joining us, and just even for this quick segment to cover some of that and just get that education out there for everyone who's going through the middle of this season, and just to have some knowledge about what's going on and what they can do. Really appreciate your time.
My pleasure. Thanks.
Thank you. And for everybody watching, again, thank you for joining us. So we are live on YouTube and Facebook, and of course the apps and the website, so lots of places to watch this. You can leave your comments and questions on Facebook and YouTube, and you can always go back and watch all of the segments that we cover, which is a huge range of things here on this show. It's one of the great advantages of Fox 12 Now. If this is the first time watching, we get to go into these in-depth, questions, educational segments. Sometimes it's interviews. Sometimes we'll have our own reporters on to do a deeper dive on a story that we've covered elsewhere, or we'll talk about an event that's coming up. It's really all over the board. And so you can always send me an email, fox12now@kptv.com. That's fox12now@kptv.com if you have an idea for a segment, or if you want to find out more about something that we've covered here on this show or other newscasts. We can always dig deeper on that and see if we can find an expert like Dr. Cieslak, who just joined us. So we do have a little bit more over on the apps and the website, so I encourage you to download the Fox 12 Oregon app, hop on over there. We've got just a few more things we'll do here to wrap up the day, but if there's breaking news, we will always be back right here where you're watching me right now, anytime between 1 p.m. and 4 p.m. This is where we'll be. So if you watched during the storms that we just had and the ice, we were here every day bringing you news and information about that. That's the same thing anytime there is breaking news. We'll be right here for you. But that's it for right now. Signing off from this segment. I'll be over on the apps and the website. I'm Greg Nibbler. This is Fox.